Hi everybody, this is our live demonstration video. Our model today is, she's a 58 years old lady with no significant medical history. She had just one-time filler many years ago on her nasolabial folds. Otherwise, she never had any cosmetic or aesthetic procedure. We're going to start with a facial analysis. We do always starting with some measurements and checking the whole face. When I look at her face, so she has some wrinkles in the glabellar region. She has some frontal horizontal lines in the forehead area. Can you make a big smile, please? Big smiling. And you can see she has some wrinkles around the eye that we call crow's feet. You can relax it now. And now we're going to see the volume loss in the face. I can see a little bit volume loss under the eye in the mid-face area. Her nasolabial fold is getting a bit deeper because of this volume loss. And she has also some Marionette zone volume loss, which is also mostly due to volume loss on the sides of the face, which can be corrected with the dermal fillers. I do a little bit measurement on her face. So usually we like that the distance between the hair growth to the base of the nose, which is the glabella, should be equal from the here to the tip of the nose and from the base of the nose to the chin area. Okay, so we're going to do some measurement. From the growth of the hair to the base of the nose or the glabella, it's about 5 centimeters. If you do the same measurement here, you can see this part is a bit longer. So one of the treatments that we can do for her is trying to make her nose shorter with the nasal with the fillers. And then from the base of the nose to the chin is also around 6 centimeters. So we can see that the forehead is a little bit shorter. We cannot much do for this shortening of the forehead because this is the structure and the anatomy of her face. But we might be able to do a little bit shortening of the nose with injection of some filler in the part of the dorsum of the nose. So we definitely don't want to make the chin longer because then this proportion would not be the same. Okay, the second measurement is the horizontal measurements. We're usually using the distance between the medial canthus, which is on her is about 4 centimeters. So this should be equal to the base of the nose, which is almost the same. So we don't need to make it narrowing of the nose. And then the same measurement in the chin, it's almost the same. And the most volume of the lip should be also in this 4 centimeters. It means from here to here, we need the most volume of the lip. And then we're going to look at the arc of the eyebrows. So again, from the medial canthus, about 4 centimeters. So this is the side of the eyebrow that we want a little bit lifting. So we need a little bit arc of the eyebrow. This side looks better. This side we need a little bit lifting. So when you're injecting the toxins, so we have to look at this part as well. So there are 3 lines that is very important whenever you want to do a mid-face lifting and volumization. One of them comes from the lateral canthus, goes to the tragus, from tragus to the corner of the mouth, and then from the lateral canthus to the lateral corner of the mouth. And then we're going to make an oval here. This is basically the area that you want to give some volume for the reflection of the light and also give a little bit lifting. If you look at the face, you will see that there's a little bit hollowing here, that you want to give some volume here. There's a little bit hollowing here. That you want to give some volume here as well. Then, the other drawing I'm going to do is a tear trough. If this is I'm going to show you the orbital rim. This is the orbital rim here. This is going to be our tear trough. So we're going to give some volume in the tear trough as well. So tear trough, we're going to do it with mid-face, we're going to get lateral cheeks, and with these 3 injections, we're getting some lifting effect. So now we're going to go to the the jawline. So this is the mandible. One of the signs of maturity on the face is that people that lose some volume in the masseter muscle and also the soft tissue of the jawline. Skin get looser, gonna sag down here and mix the jawline here. And because we have a very strong ligament here, we see that, you can see when I push the soft tissue, it's gonna stop here because of the ligament. So they're gonna stop here and mix the jawline. So one of the treatment that we can offer to our client is to injecting a little bit filler in the jawline to give it lifting effect. So I'm going to draw the jawline here. So I'm going to inject some filler here. And also just to make it more straight, I'm going to inject a little bit filler in the front of the jawline as well. And now we're going to look at the Marionette zone. We don't call it Marionette line anymore because it's not a line, it's a zone. So this is the Marionette zone in the front of the mandibular ligament. This is also the area that we're going to lose some volume, corner of the mouth, and this makes the corner of the mouth to go down. So if you put some filler in this area, you're going to push the corner of the mouth up and also pushing the ligament up as well. The other area I want to give some volume is the temple. This is also a very common area that people lose volume and they don't notice, and it has a very good effect when we are giving some volume back and making the face more younger looking and healthier looking. So for this area, I usually make a line where the frontotemporal junction is. So you can feel it on the face of the patient. This is where the ridge is. And then we have the orbital rim. That's the orbital rim. That's where the frontotemporal ridge is there. So we usually inject the filler in this area. An injection can be both deep or superficial. I myself, I like to do deep injection here on the bone. Some doctors, they do a superficial injection. So this is another area that we can inject some filler. There are a few anatomy landmarks I want to also mention to you. Can you make it like a biting? Okay, so we're going to try to find the masseter muscle. This is almost the anterior part of the masseter muscle. Usually the facial artery is just in front of this muscle. So it comes here, makes the angular artery, and go all the way up. So this is the facial artery. So we are injecting the filler, and you want to be avoiding this artery. It's usually in the front of the masseter muscle. And in the upper face, if you touch the orbital rim, you usually find a ridge here. This is where the supraorbital artery is going all the way up with the nerve, with the vein. Okay? Can I make a frowning game one more time? So if you just relax. So when we look at the depressor supercilii, there's another one important artery here, which is the supratrochlear artery. Go all the way up here as well. So important anatomy landmarks that you should know when you're injecting any filler in the forehead or temples. The other area that I would like to give a little bit volume to her, it's the forehead. So if you give a little bit volume to her forehead, so you have a very nicer light reflection in this area as well. But again, this is an area that you should be very careful because of the two arteries here. So when you're injecting here, the artery, both of the supratrochlear and supraorbital artery, and the first 1 centimeter, they are very deep. As they go higher, they get more superficial. So when you're injecting the filler in this area, in the forehead, it should be deep on the bone. You're not injecting superficial here to avoid the artery. And then we can inject a little bit filler in this area to make a little bit lifting of the tip of the nose. And then for the small hump that is here, we can also inject a little bit filler into the dorsum of the nose. This is going to make the nose shorter looking and also a little bit lifting. And our last injection for her would be the volume for the lower lip. Okay, so we're going to start with a toxin injection. Can I ask you to make a frown again? So we're going to grab the posterior muscle. Just relax it, please. So we go directly to the belly of this muscle. I'm going to inject about 5 units of Botox equivalent. So today we are using the Botox Allergan, but you can use Dysport or Xeomin. The only difference is that Dysport is a little bit different in the equivalency in the units. Frowning again, please. Okay, relax. So we're going to grab the depressor. I usually put my finger here below the muscle because I don't want that the toxin spread to the levator of the palpebra. So I go directly to this muscle and inject between 3 to 4 units. The depressor supercilii. Same here, frowning again. Relax, please. Again, I put my finger below. Go directly to the muscle. Okay. Frowning again. Relax. Last part is the corrugator. So the importance is that when you're injecting to the corrugator, it won't be at least 1 centimeter above the orbital rim, not the eyebrow, the orbital rim. So about 1 centimeter above. It goes superficial. This injection should not be very deep. Frowning again, please. That's the last. Relax. Okay. So that's the glabellar region. Okay, the second region in the upper phase for botulinum toxin is the forehead. Can you raise up your eyebrows, please? Okay, so you see the very strong frontalis muscle. Now relax it, please. So we are doing multiple injection, but a very small amount. I usually like to not inject in the first 2 centimeter lower part of the frontalis because of the risk of the drooping of the eyebrow and eyelid. So I stay above from this 2 centimeter, raise up again, and relax. Okay, so I'm going to do a multiple injection, but all very small amount, like a 1 or 2 units. Press again. Okay. Okay. Raise up again. Relax, please. One more time. Raise up. Relax. Excellent. That's the frontalis. So we're going to give a little bit volume to the forehead, frontalis. As I mentioned again, the arteries here are usually very superficial after the first 1 centimeter. All the injections in the forehead, it should be very deep on the bone. So we are not injecting superficial here. Ready? Okay. And you're injection very slow, looking at the skin, be sure there is no signs of ischemia on the skin. Usually it makes a lump here because it's very superficial. The soft tissue is very little here, and then you spread it. So you can use any type of filler, but it should be a filler that has a tendency to spread. You are not using a very thick filler in this area. Okay, on the bone, you're just looking at the face, at the skin, slow injection, just be sure there's no signs of ischemia. There's no blinching, there's not significant pain, these are signs of ischemia. If the patient says it's so painful, stop right away. You don't want to make any ischemia here. And if the ischemia happens, you know what to do. Okay. It's always possible that you pass through the artery or the vein and makes a big bruise here. So pressor, spreading the filler, and press after. Even if there is no bleeding, always press after, because it's possible that you pass through a vein and start bleeding under the skin, and the client next day has a big bruise there. Looks very natural. I injected 0.2 mils of filler. Okay, can you make a big smile, please? So now we can see the crucifix lines with the contraction of the orbicularis oculi. Now relax, please. We're going to find the orbital rim. We try to stay about 1 centimeter lateral to orbital rim. This muscle is very, very superficial. We are injecting very, very superficial. Okay. Okay. I usually do 3 injections. We can even do 4 injections, especially for her, because she had very strong lower part of the orbicularis is very strong. Can you make a big smile again? And see the lower part of the orbicularis is very strong. So even if you inject 1 more here, it should be fine. Okay. Okay, now we're going to do the temple region. So we're going to find the frontal temporal ridge. You can feel it here. And then the orbital rim. So 1 centimeter above, 1 centimeter back. You just want to be sure there is no vein or artery here. Again, this injection can be deep or superficial. So I go deep, but you can also go with a cannula and go superficial injection. 1, 2. So I can touch the bone here. Now we're going to inject. Again, inject slow. We're going to look for any signs of ischemia. Okay, now we spread it. It's better that you put 1 finger behind it, because we don't want the medication going behind. Injection here. Something that is very important is temple in ladies should not be completely concave. You always want it to be convexity. Otherwise, you're making the face masculine. So you don't want to make it like a man, right? So a little bit. Okay. So you can see, sorry, I'm just moving your face. You can see here, compared to here, you see the improvement of the hollowness here. Okay, now we're going to do the mid-face. We're going to give some reflection of the mid-face and a little bit lifting of the nasolabial and mid-face area. We did already the drawing. I'm going to explain again 1 more time. The line from the corner of the lateral canthus to the corner of the mouth to the tragus, and then there is a horizontal line from the lateral canthus. There is an oval here, which is basically the area of the mid-face that we want a nice volume. So we're going to do a little injection in this area. This injection is going to be also in the deep fat. Injection will be very slow. So we're going to get a bit volume into lateral cheeks, deep into the deep fat tissue and the bone. I do a little bit lifting always when I do my injection. And I can see a little bit volume loss in this area as well. So we're going to give it a bit of volume here as well. Okay, so we're going to compare the two sides. Just look at the nasolabial. You see the difference here. Just with small amount of filler, they got the lifting effect here. And if you actually want to move, see the light reflects here. We make it here. There's no light effects here. So now we're going to do the tear trough a little bit here. So you can see the amount of injection, it was 0.3 mils of filler. With very small amount of filler, you're getting very nice soft lifting of the nasolabial and corner of the mouth when you compare these two. So we're going to do a quick review of the tear trough area. So we have the orbicularis ligament here, and then we have the zygomatic ligament. These two ligaments, they join each other, then they make the tear trough ligament. The orbicularis muscle is a very superficial muscle that is in the medial side, is directly attached to the bone. So there is no space between the muscle and the bone. If you inject the filler in this area, you're not going to inject under the muscle. You're actually injecting into the muscle. And patient will come back with a lot of swelling, lumps, and they're not going to be happy. So we're not going to inject in the medial side. We're going to inject below the ligaments. So we're going to start from here. We can also use a cannula. Okay, below the ligament, deep on the bone. Okay, perfect. So now we're going to try to correct the Marionette zone and the jawline, the mandible angle. So you can see the line here is a little bit jawing and sagging in this area. So we're going to try to do a little bit soft lift with injection of the filler into the jaw line and the mandible angle. I'm going to inject a little bit in the jawline here as well. Try to make it more straight looking. This injection is also deep. The bone. Okay, for the correction of the Marionette zone, I'm going to use the cannula technique. So I'm going to make a small incision with a small needle. I usually do a little bit spinning. Okay, so this one. Yeah. Let's take this one out, please. Okay. Perfect. Good. Fanning technique with a cannula. Yeah, it's going to hurt a little bit here because you're passing through the nerve. Good. Okay, so we're going to do a little bit correction of the nose. We're trying to make the nose a little bit looking shorter and a bit lifting of the tip of the nose. So we're going to do a little bit injection here. I know this is a little bit tender area. Again, this is a advanced technique. I don't recommend you to do it if you don't have enough experience in the dermal filler injection. Look for any signs of ischemia. Injection should be very, very slow and very small amounts. We're injecting about 0.1 to 0.2 to get a little bit lifting effect. So we're going to do a little bit to the tip. It's very small injection, very, very slow. I'm going to give a little bit volume to the lip. Can you open your mouth a little bit? Okay, so we're going to give a little bit volume to this area. Open again. Okay. So we are not doing a lip augmentation. All we are doing is just giving a little bit definition. Okay, so we finished our model today. So just as a summary, what we did for her, we did neurotoxin for her upper face wrinkles. We did a little bit filler in the forehead area. We did a small amount of filler in the temples. Mid-face, we give a little bit augmentation into the cheeks and mid-face for the soft lifting, small amount in the filler, in the tear trough area, marriage zone, jawline. So the total amount of filler we used today was 3.5 syringes of filler, and we injected about 50 units of botulinum toxin. We used the Botox today, but you can use any type of botulinum toxin A.